Everyone experiences fear at some point in their lives. Fear can be a natural response to potential danger, and it can help us stay safe and avoid harm. However, for some people, fear can become overwhelming and irrational, leading to a condition known as a specific phobia. Specific phobias are one of the most common anxiety disorders, affecting around 12% of the population at some point in their lives. This disorder involves an intense and persistent fear of a particular object, situation, or activity. The fear response is often disproportionate to the actual danger posed by the object or situation, and it can interfere with daily activities and quality of life. Let's take a closer look at the specific phobias mentioned earlier and their characteristics. Arachnophobia. This is an intense and irrational fear of spiders or other arachnids. Even the mere sight or thought of a spider can cause severe anxiety and panic for someone with arachnophobia. People with this phobia may avoid certain areas, such as gardens or basements, where spiders are more likely to be found. Acrophobia. This is an intense and irrational fear of heights. People with acrophobia may experience anxiety and physical symptoms such as trembling or sweating when in high places, such as on a tall building or bridge. They may avoid high places altogether, which can limit their ability to enjoy certain activities or travel. Claustrophobia. This is an intense and irrational fear of enclosed or confined spaces. People with claustrophobia may experience anxiety and panic in small spaces such as elevators, airplanes, or even crowded rooms. They may avoid these spaces and may feel the need to escape immediately if they find themselves in them. Aerophobia. This is an intense and irrational fear of flying. People with aerophobia may experience anxiety and panic when they have to fly, which can interfere with their ability to travel and enjoy life experiences. This phobia can be particularly challenging as air travel is often a necessary part of work or social life. Trypanophobia. This is an intense and irrational fear of needles or injections. People with trypanophobia may experience severe anxiety and even avoid medical procedures that involve needles or injections, which can put their health at risk. This phobia can interfere with regular medical checkups and necessary medical treatments. Cynophobia. This is an intense and irrational fear of dogs. People with cynophobia may experience anxiety and panic when they see or hear dogs, which can interfere with their ability to go outside and participate in social activities. This phobia can be particularly challenging as dogs are common pets and are often seen in public places. Astrophobia. This is an intense and irrational fear of thunder and lightning. People with astrophobia may experience anxiety and panic during thunderstorms, which can interfere with their ability to go outside or even leave their homes during stormy weather. This phobia can be particularly challenging as it can interfere with daily life, especially in areas with frequent thunderstorms. People with specific phobias may experience physical symptoms such as rapid heartbeat, sweating, shaking, and shortness of breath when confronted with a feared object or situation. These symptoms can be distressing and can lead to avoidance behaviors, which can further reinforce the phobia. Fortunately, specific phobias can be treated effectively with various therapies. Some of the most common treatment approaches include cognitive behavioral therapy, CBT. This therapy aims to change negative and irrational thoughts and behaviors related to the phobia. Through gradual exposure to the feared object or situation, patients can learn to tolerate and overcome their fears. Exposure therapy. This therapy involves repeated exposure to the feared object or situation in a controlled and safe environment. With the help of a therapist, patients learn to confront their fears and gradually reduce their anxiety. Medication. Certain medications such as beta blockers or anti-anxiety drugs may help alleviate physical symptoms associated with specific phobias, but they do not address the underlying causes of the disorder. Mindfulness-based therapies. Techniques such as meditation and relaxation exercises can help reduce stress and anxiety related to specific phobias. While treatment can be effective, it is important to seek help from a mental health professional if your phobia is interfering with your daily life. Overcoming a specific phobia can be challenging, but with the right support and resources, it is possible to lead a fulfilling life free from the constraints of fear. Specific phobias can be debilitating and impact a person's daily life. However, with proper treatment and support, individuals can overcome their fears and lead fulfilling lives. If you or someone you know is struggling with a specific phobia, seek help from a mental health professional. Remember, it's never too late to overcome your fears and live the life you deserve.